Hello, this presentation is a summary of infectious diseases expected to peak in Taiwan in the 90 days between August and October of 2013. This is a presentation of Ascel Bio, the disease forecasting company. First, the headlines. Dengue risk is rising in Taiwan. That means beware of mosquitoes. Use mosquito propellant and exercise careful control of mosquitoes. Scrub typhus risk is rising too. This means avoid dusty areas and rodents. Maintain a clean environment. Hepatitis C risk is rising too through October. Hep C is spread when blood from an infected person enters the body. Sharing needles, needle stick injuries, and less commonly, sexual contact are how the disease is spread. Ascel Bio has put together this almanac with official data and is processed through Ascel Bio's proprietary disease forecasting software called Delphi, which is sold on our website. There are 27 diseases covered in this presentation. About 14 of them have historically peaked between August and October. The peaking diseases are listed here, and we'll go through them in the technical forecast. Incidence of chickenpox amongst all the diseases that we forecast is relatively high. It's not peaking between August and October. The rise of dengue risk is quite clear in Taiwan. So is dengue hemorrhagic fever. Flu risk is reduced. Mumps risk is elevated, but coming off an earlier peak. According to Ascel Bio's climatology, pneumococcal disease should be at a seasonal low. Scrub typhus risk is elevated. As mentioned in the opening, there is a bump in risk of amoebiasis in September expected. Acute flaccid paralysis has come off an earlier peak. Hep A risk is present, but not as elevated as in March. Hep B risk is also present and is expected to rise closer to October. Hep C risk is projected to rise according to the climatology in October. Melioidosis risk is peaking in September according to the climatology prepared by Ascel Bio off of official data. Leptospirosis risk peaks between August and October, according to our calculation, as does whooping cough. Legionnaire's disease risk is elevated between August and October, rising in December. Enterovirus will come off a peak in August, but cat scratch disease will be elevated this month. Paratyphoid risk is also rising. There is a bump in Q fever risk in August. Ascel Bio is monitoring the relative heightened risk of tetanus between August and October. Malaria risk demonstrates a clear seasonality with a peak in September. Murine typhus risk is reduced between August and October, as is rubella, as is measles, as is Japanese encephalitis, as is H. flu.